All right. Hello, everybody. This is Samori Swigert with Swarthy and Swank. And we are blessed and privileged to have such a, how can I say, a blessed presence, an aura, contributor, provider by the name of Dr. Julissa Hernandez. I've had the pleasure to work with her on the peripheral. We used to be on the same radio network, Source Radio Network, and she has all types of radio shows, podcasts, books. You go want to follow her on social media because she has all the cues, the tips, and the data and information that is needed for you to kind of keep yourself vitalized, revitalized, keep you performing and proficient as a man in your relationship in the bedroom, also tied in spiritually. So without any further ado and being verbose, Dr. Hernandez, can you just give a little intro of yourself to the people of Swarthy and Swank?
Oh, well, thank you so much for having me, Dr. Samori. It's an honor to be here. And no need to be so formal. Everyone in my whole career just knows me as Dr. Julissa. That's all you need to put. And that's how everyone knows me. And I'm honored to be here. You said to share a little bit about me. Wow. I love to talk about my hosts and hostesses on all of these platforms. However, I'm a board certified naturopathic doctor, practicing now for over 20 years. And my home office is located just 2 blocks from the Empire State Building. I'm on Park Avenue between 33rd and 32nd Street. However, I do have offices across the US in 35 other states where I do travel to see patients as well. And of course, telehealth is a huge thing. So for those that can't wait for me to travel, I also do perform telehealth consults. And as a general practitioner as a board certified naturopathic doctor, it seems that my work has really pushed me more towards becoming what many people know me as today, also a sexual health expert.
All right.
Because I truly, truly feel that sexuality is at the core. It is the very essence of our health, life, and well-being. And every single human came from sex. So it is at the core of our health, whether you think it's, just, an issue with some other part of the body. When we look at it, since that is where we came from, a lot of things tie back to that as far as root causes of a lot of that's where all of that came from. And with regards to men's health, that has been a blessing to be able to help couples at least 100%, knocking on wood as of today, still have a 100% success rate in helping couples conceive. And so whether it's the man or the woman that has the challenge, we work on both to be able to achieve that. And if not that, then it's just making sure that we help men to overcome issues of the testicles and prostate, and just to make you feel virile, have stamina, feel good as a man, overall balanced hormonally, have those testosterone levels where they need to be, and everything in between, to muscle development and more. So let's athletes that I treat with all of those types of concerns and so on. So I'm at your service to hit me with the questions that you may have, and your amazing fans and followers as well.
Oh man. All right, fellas, you heard that. She's about to give us the jewels. All right, so Dr. Hernandez, so okay, I'm a 44-year-old male. Now, science and research says, when males hit their 40s, this is where they really kind of start seeing a decrease in their testosterone levels and things of that nature, right? What are some things that we should be doing, maybe whether it's through herbs, food, or whatever, that we can consume or implement our routine outside of the pharmaceutical testosterone therapy? Because they're making tons of money off of this, synthetic testosterone supplementation. Well, in your practice and that you've seen, improvement in performance, what do you say as a naturopathic doctor?
That's a wonderful question, Dr. Samori. So the challenge lies in that when you're using medication, pharmaceutical drugs to try to correct an imbalance like that is hormonal, just mentioned testosterone levels, you're most definitely subjecting yourself to side effects. We're talking about an overloaded liver because
Mm,
that's the chemical plant of the body. Every single drug, well, you need to know this, every single drug that you take, everything that's chemical and such needs to be filtered through the chemical plant of your body, the liver. The liver is the filter of fat, it is the filter of blood, it is the filter of hormones. And so if that vital organ is not in a correct state of balance, you then have, apart from having those issues that you already are taking these drugs because you think that that's going to correct your issues with testosterone, then you're going to be having issues with weight gain because now the liver's overloaded. Then you're going to have issues most likely with blood flow and cholesterol because again, the liver is the filter of blood. And so all of those things, that everything in the body is interconnected because I work a lot with ancient medicine. My form of practice is really what I call universal medicine because I do bring what is over 5,000 years old Chinese medicine and ancient medicine along with naturopathic and holistic medicine. And of course, I have to know what my colleagues in the conventional medical industry are doing as well to prevent the side effects that much of that is causing. Before I continue, I do want to say, don't misunderstand me. We can't negate any form of medicine. However, conventional medicine, allopathic medicine, regular medicine, let me call it that because that's how a lot of people kind of can differentiate it. It is considered in what we know as tragic medicine. The divine forbid, you're in a car, you get into a car accident. Yes, take me to the hospital. Do what you have to put me back together. But it does not prevent disease or cure. The fact that we can still, perform surgery on a fetus while it's still in the womb, those things must exist. We have to have that in today's world. But naturopathic medicine is to prevent disease and help the body with healing. You are not going to mask symptoms and think you're going to heal yourself. That's not the way that it works. So they do have their place. In essence, then, what do I recommend? I have to recommend for a man that's going through andropause. And every woman goes through menopause, but they go through some uncomfortable symptoms. A man goes through andropause and doesn't have to go through uncomfortable symptoms, like the testosterone levels being low at that point. Then they're gaining belly fat and they're having low sex drive and they're having low energy and their mood is swinging and they're angry most of the time. And all of that, believe it or not, has to, and feeling more stressed as they age. Those are negative symptoms of andropause, which is what the man goes through after the age of about 35 or 40. Change in diet, Dr. Samori. Okay, if you're eating a lot of, and I'm going to throw this out there, let's say meats, let's pick a specific meat, let's say chicken. Estrogen is highly present in chicken that, for example, is not organic. With that, I'm not saying that I definitely want you guys to all eat all kinds of meats. If it were up to me, you'd all be vegetarian. However, having said that, it's a transition and not everyone has to per se do it, but it is much better for your health. But let's talk about chicken, for example. Before 1940, Dr. Samori, and I used to talk about this a lot on the Michael Baisden show. I don't know if you ever listened to that. I'm Dr. Julissa, the resident naturopathic doctor from the Michael Baisden show for 9 years, the last 9 years that he was on the air. And I talked about this a lot when it came to men's health, and he brought up these types of topics. Before 1940, guess how long it used to take a chicken to grow to market size? From the day it hatched, before 1940, from the day it hatched to the day that it was sent to slaughter, how long did you think that would take before 1940?
I don't even know.
4 months,
No, 4 months.
normal chicken growth. Today, less than 4 weeks.
Wow.
From the moment it hatches to the moment that they're sent to slaughter, they are so pumped up with so many hormones, and they're fattened, and their legs can't even carry their huge plump bodies, because by 4 weeks, just a month after hatching, they're already sent to slaughter. They're already big enough to be killed. And so could you imagine the amount of hormones that are going into that animal? And then people intake that, and I have men asking me, well, why is my testicle swollen?
Mm.
And I have a man asking me, why do I have a cyst on my right testicle?
Mm.
And I have a man asking me, why do I have an inflamed prostate? My father, my grandfather, no one in my family had it. Why am I the first one?
Mm.
In my 20s, I used to be a stallion. And now I'm 42 and I'm having problems getting an erection with my girlfriend. And I'm attracted to her. I love her. What's happening?
Right.
So these are the types of things that I'm seeing in 27 years of practice. This is the type of situation that's coming into my office. And a lot of these things have to do with the foods. Okay, so I've mentioned that. Let's make sure you're not drinking tap water also, because of the fluoride that is very much found in those things. Let's drink filtered water. It's so many little details. It's never just one thing, Dr. Schweigert. It's never
Right.
just one thing, Dr. Samori, never. I always say the perfect storm has to be happening within the body for disease to set in.
Mm.
It has to be a combination of things. So those are some factors. Yes, the diet has to change. Yes, some lifestyle habits have to change. If you're a smoker, I'm going there. Are you ready for me? Yes, I'm going. I'm going there. I mean, smoking anything,
Mm.
from hookahs to anything, anything. How am I going to help you get a strong erection if anything that you smoke hardens your arteries, causing atherosclerosis, and then there's poor blood flow going to the penile region, and you're complaining why you can't get an erection that's hard enough to be able to penetrate your partner? Yeah, stop that.
Mm.
Okay,
Mm.
so it's a balance. It's a lot of things that come into play, and herbal therapies have done wonders. I've been using these therapies to help my patients for, again, 27 years with amazing success. And what I used to have only available to my private patients, I now have available to the public. That's a new surprise.
Y'all better make sure y'all follow her, because she's about to give it up.
Yeah, so that's that they'll find on my website. But I hope that answered your question, Bart.
Yeah, no, definitely, definitely. Because it's important. And like you're saying about like the food, I think so much has just been tampered with over the last, let's see, so I'm 44. I feel like there's just, since I was born all the way up to now, there's been so much tampering with the food supply and water supply, man. Like I look at like all these different food allergies that happen. I'm like, when I was in elementary school, where do you have all these food allergies and gluten allergies and all this different types? It's like but it's like now they're doing so much GMO of our food, uh, from the amount of hormones that are, like you said, in the food, to the what is when they spray their pesticides on the food and stuff that's in the water that's irrigated onto the crops. It's just a lot. And so yeah, you do have to ask yourself, how is this impacting me and affecting me as a man? So definitely true. Another question that I kind of want to get at with you. What are some foods that you would say, you said chicken. What are some other foods that we should probably kind of avoid or tone down our consumption of? Like a lot of people are familiar with like soy, and soy having some estrogenic effects on the male. Are there any other foods that men should probably try to avoid in your practice?
Soy is controversial.
Okay, look, we're here for the controversy. We're here for the knowledge. Okay.
Yeah, soy is controversial. If if it really was something that detrimental, then, you know, so many men in Asia would.
Mhm.
It's the processing of certain foods that may be soy-based, but if you buy organic soybeans and your blood type A, I must say that blood type A's actually benefit from foods that are rich in soy. So not every, I do focus on that also in my practice because there's a reason why certain families suffer from certain diseases. And it does have to do with the metabolism and makeup of those people, including their blood type. Okay. So a person that's blood type A actually benefits from eating foods that are rich in soy. Now, when I say soy, I mean, for example, if you're buying organic soybeans and you soak them and you cook them, okay. If you're a man that is concerned about that, maybe that's going to increase your estrogen. I highly doubt it if you're eating organic soybeans, and especially if you're blood type A. But having said that, meats. You're saying which other foods should be most avoided? I've treated way too much prostate cancer, and the way that I help reverse BPH, benign prostatic hyperplasia, prostate inflammation and such, I have to eliminate dead animals from the diet. And that means fish too. You know, but I eat fish. I don't eat meat. I eat fish. It's still a dead animal.
Right, yeah, right.
It's still a carcass. Okay.
Right,
So no
right.
carcasses. You know, if you let's do that. Let's try it. Do it for at least 90 days. You'll love me in a week, but do it for at least 90 days. Every 90 days, the cells of the body tend to regenerate. So every patient that comes to me, leave your body to me. That's my job, to know what I need to feed this body, to nourish this body with, to recommend. And then I need their help with the emotional. But those are, I don't want to give away my secret sauce. Those are the things that come up in the office when I'm examining my patients, things that they don't expect for me to mention that I see in my examination are root causes of why they're having such. So that's a factor. Meats, most definitely. You know, vegetarians are 3 times less likely to suffer from cancers than those that are meat eaters. There it is. The numbers don't lie.
Right.
Well, that's a fact. That's a factor. I mean, there are a lot of movies out there that'll help you with making those decisions. I'm not saying vegan. I'm just saying more on the vegetarian side, as often as possible, to eliminate the meats. It would help greatly with performance and such. I mean, many of you probably.
Oh wait, hold on. You say
Many of
that
you
again?
have probably seen that movie Game Changers and so on. Have you seen that yet?
Nah, not yet.
Oh
Game,
my, you need to see that. You know why? Because 3 football players are put in that documentary and their erections are actually monitored on 2 consecutive nights. Before on the first day, they were all given either chicken or beef burritos, and then they measured how many times they had erections. The next day, they were just given bean burritos. The next night, they were measured their erections. 300% more erections after they had the bean burrito. Gentlemen, listen up. 300% more erections throughout the night. Hello. That's something to consider.
Right.
That's something to consider, my friends.
Yes.
And if just cutting out carcasses can do that without anything else, I mean, that's amazing.
Oh man. Okay. All right.
I recommend watching that movie. It's a great documentary. Yeah.
You said it's called Game Changers?
Yes, Game Changer. Yeah.
All right.
You know, Arnold Schwarzenegger doesn't eat meat.
Oh, really?
Not anymore. Not after he found out what was going on with his body. Yeah.
Yeah. He has a whole lot to go on with. I sometimes always question his whole thing with steroids too, but
yeah,
you know.
Yeah, he's changed completely as far as that's concerned. And again, I work with a lot of athletes. Again, HIPAA compliance. I cannot say names, and bodybuilding as well. everything from pain management and so on to helping them with healing if they've injured themselves and such. But most definitely that male balance and performance that they want to have, not just on the field or in their sport, but most definitely with their partner.
Mm. Now you talked about performance. A question that a lot of guys, sometimes we have these discussions, and just even in relationships, people want to know, like, well, what's considered normal sexual routines? Like, should couples, whether married or dating seriously, should they be having sex every day, or is this what from what you've your years of experience, what would be considered normal frequencies of intercourse with a devoted couple? Because then I have a question to back off of that one.
Okay. Well, I would have to ask you then, it depends on the couple. If the couple is in the right years of life that they want to start a family,
Mhm.
or have they now been together for some time, have had their family, and no longer want to conceive. You may think that there's no difference there, but there is a difference also in the way the man would perform. I'm a Taoist, if you know Taoism,
Yeah.
in the realm of Buddhism. Okay, and so spirituality does tend to flow into my practice, never overstepping the boundaries of religion of any of my patients, but that is just what I bring in to also the work that I do with my patients. And if we're considering a man that is married or with a partner that wants to help her with conception, then more often, at least when I'm working with a couple that's trying to conceive, the time that the woman is in an ovulation cycle, they have to have sex all 9 days straight,
Mm.
for 9 days. So in that time,
Right.
if we're talking, and then so as often as you both feel it is comfortable. If now the concern of conceiving is no longer necessary, then a man does not want to continuously lose his vital energy.
Mm.
And that, yes, that is Taoist sexual teachings, wherein the man learns to can perform as many times as he feels desire without ejaculation. And ejaculation, if it's later on in life, maybe no more than 2 or 3 times a month, actual ejaculation. But that doesn't mean that that's the only, he only has sex 2 or 3 times a month. He can have sex as often as he'd like, but we don't want you to lose vital energy because you're no longer wanting to get someone pregnant. You need to retain your life force.
Mm-hmm.
So it's a delicate where, my male patient has to learn, well, on a range of 1 to 10, once you're at 7 and 8, hovering there and and feeling the explosion of an orgasm without the ejaculation. But once you've gotten to 9, that's it, it's over. 10, you're done. It's going to happen. But we want you to be able to learn at that point where you're not any longer trying to help a woman conceive, to be able to hover around that 7, 8 and feel that amazing sensation of that beautiful orgasm without ejaculating, and still have energy afterwards, and still be able to go to the gym right afterwards and lift weights and so on, but not feel like you need to nap for another 2 hours right
Right.
afterwards. You feel wasted and drained.
Right.
That's not, no, you want to retain life force. And those are Taoist sexual teachings, some of the things that I teach.
Very important. Is that also what they refer to as like tantric I guess love making? Is that kind of like tantra or not really?
I know that in the realm of tantric sex, there's the practice of also making your partner orgasm almost without touch and just kind of using energy.
Hmm.
I love to recommend touch, so it's different.
Mhm. Okay.
it's where studies have shown that we can live without sex, but we can't live without touch. It's very important to be very affectionate in your relationship. Here's a great tip. You may want to write this down, friends. Listen. A man should hug his female partner minimum 5 times a day.
Hmm.
Why? Hug, chest to chest, left cheek to left cheek. Okay? The left side of the body receives, the right side sends forth. So on the left cheek to left cheek, chest to chest. Why? When you're hugging her, her stress levels come down. She's less tense. She melts in your arms, but she produces natural estrogen, and you produce, gentlemen, natural testosterone when you're hugging a woman.
Wow. Wow.
Naturally,
Wow.
you produce testosterone when you're hugging a woman. Why? On an emotional level, what the mind starts doing, what the body starts to do, producing your testosterone, you as a man, when you're supporting the female, when you're offering protection, safety, and that has been found in studies to be one of the things that chemically in the brain and then the body starts reacting, where you start producing testosterone. So every man that comes to me with prostate challenges and this and that and low testosterone levels, he has to hug his partner minimum 5 times a day. Now, she can't ask for it. She can't know when it's coming. That's different, because then she's going into you, and I don't like the word chasing, but look at the way that we're made, yin and yang. She is the receiver.
Yes.
The man is the giver. And you feel like a man when you know that you are giving support, when you can give that shoulder, when they can lay on, being able to depend on you and so on. And that naturally has the man producing natural testosterone, proven in study. So that's significant. That's a significant thing that you guys can all do today. Don't let her know when it's happening. Just grab her and hug her. You'll feel better. Your levels will be much better. That's another natural way of living.
Hey guys, there you go. Listen, hey. And I really don't doubt that. Like, because I know especially you remember the days of your youth, fellas. I know, there are times when, you can just hug the girl that you're interested in, and it's just like you're ready. It's something you could have been in close proximity to them, and it's one thing, but as soon as you start hugging, it's like that thing is knocking at the door, so okay, all right.
Is that a gun in your pocket, or are you just happy to see me? Right.
Exactly.
Yeah.
How about this? Let's try this one. What are some things guys should be considering for building functional sperm and seminal volume? I say that one because of guys that may be wanting to have children and want to make sure that their sperm is functional and they're ready, at least on his end, his soldiers are ready to penetrate the wall. That's one thing. And then also for volume, for women, just as much as guys, like when a woman orgasms and she's coming, well, if
Go
she's
ahead. I hope all
yeah,
your listeners are over 18. So
right. But if she's coming very hard, you like to know that, you like to see it, like you're like, okay, I know I'm doing my duty. I know that she's satisfied. I know that she's pleasured. And also I believe for the woman that some women are very, well, I do know too, but a lot of women that, hey, when they see the male ejaculate, and if it's like a robust amount, they're very satisfied too. Like, I really pulled that out of him. Like, like they, some women may not like all that, but a lot of women, they feel like, hey, I really did something to him or for him and pleasured him, satisfied him, brought him to that level. So also, what are the things we can do as men to increase that seminal volume for that, that effect, and also good functional sperm as far as procreation and fertility?
Wonderful, wonderful question. So you're a man is considered infertile if he has less than 10 million sperm per milliliter.
Mm,
When I'm working with my patients, I mean, whether he's trying to help a woman to conceive in his life or not, but just in general, I double their sperm count in 30 to 45 days with the, yes,
damn.
with the therapies, yes, with the therapies that I give them. Again, it's over 27 years of this, so it's a beautiful thing to be able to do that. And so that's an easy fix, really, really easy fix, because we change all of the stuff that was, lowering it in the first place. And sadly, in the last, I'm going to share with you, I just did a podcast of my podcast, Epic Sexual Health, on iHeartRadio and Spotify, and I just spoke about how sperm count has decreased worldwide, Dr. Samori.
Mm,
In the last 40 years, it's lowered by half.
mm, wow,
Correct. Yeah.
that's
So
scary.
very scary, because there are countries where no children, in China, no children have been born, I believe, in the last 3 months. That's
Wow.
just to give you an idea that India as well, and such countries that are having issues with fertility. And so I wish all of them would come to me so I can help them, right? Yes, yes. But that's the doubling of sperm count, easy. I do that all the time. Been doing it. And again, still have a 100% success rate in helping couples conceive. Nothing is perfect in life. However, the divine works through me in helping couples to achieve that. That can change at any time, but as of today, that is the case. Now let's talk about the normal sperm formation. We need to be sure that there is normal sperm formation, that the head is shaped properly, that it is naturally nice and oval shaped, that the tail is not crooked. Okay. All of these factors that are genetic, probably imbalances that male is having, where we need to correct some of those things that are going on, because I take that into account if their female partner has conceived and miscarried.
Hmm.
Well, why? Oh, well, nobody, but the doctor couldn't tell us what was wrong. We don't know. I just lost it after a month, let's say the woman says, or I miscarried after 2 or 3 months. It's nature's way. It's very sad, but it is nature's way of telling us that that was not a viable pregnancy. Well, why? I have to take a lot of these things into consideration. Was it her eggs? Was it his sperm? That maybe that baby was just not viable. So in those cases, I give certain therapies just to make sure that everything is healthy and naturally formed and very well formed. But all of those things, yes, come into play. Now, you said that the woman feels satisfied when she sees that he's ejaculated a lot. Great. I do and have entertained hearing that from patients in the past. But keep in mind, if you're not trying to help her conceive, a man ejaculating 2 or 3 times a month and still having sex other days and not ejaculating is holding on to your life force. Remember, okay? So unless you're trying to help her conceive, that's when you're on a rampage ejaculating. At least I have my patients go on a baby marathon, minimum 9 days straight. When she's in an ovulation cycle, I have to tell them you have to have sex all 9 days. Now I prepare them for that. They're taking aphrodisiacs. They want to get busy, as we
Yeah,
call
right.
it. Right? This brings them closer. I walk them through it. I tell them exactly, the best positions and such, and all of the wonderful things. Then they want to, because they're all heightened with all of the things that they've been doing for 90 days, and then we're trying. Okay. So but if the man is not trying to help her conceive, then hold on to your sperm. You can hover in the 7, 8 before reaching 9, 10. That's it, it's over. But you can hover in that 7, 8 and feel such an exhilarated orgasm and not ejaculate and still retain your life force. I mean, I want you all to live past 100. But if you're constantly letting that go, and you're not impregnating anyone, then you're losing life force. You're diminishing your longevity.
Mhm, mhm. So,